I've treated many professional golfers. But when I talk with them, I've got to give them the facts. So I'm going to give you the facts. And again, I'm just the messenger. Don't shoot the messenger. Uh, if any procedure is best for golfers, it's the Discseel procedure for these reasons. And it's because of these reasons, by the way, every intellectually honest spine surgeon would agree that the Discseel procedure is better than any procedure that they could offer surgically. And that's because the Discseel procedure doesn't change the dynamics of the spine. The Discseel procedure brings the spine dynamics back to normal. There is no spine procedure that does that. Obviously, the spine procedure that's worse for golf would be a fusion or disc replacement. It may give temporary relief, but facts are facts. The spine is made very well, naturally. But if one takes one of those levels out of play, if they fuse it with an artificial disc or with a fusion, and it doesn't matter if it's an minimally invasive fusion, those are almost gimmicks because they still cause the same problems. They fuse a segment, and that spine's made to move. And as soon as we immobilize one segment, every surgeon in the world knows that it's going to increase detrimental forces on the remaining discs. It's going to predispose those remaining discs towards accelerated degeneration. And that's especially true if a person continues to golf or continues to play football or other sports. And again, I treat a lot of professional golfers, and so we just convey the facts. And here's the facts. The reason that the Discseel procedure is better than any spine surgery procedure, no surgeon can say otherwise, is because the disc stays natural. It's meant to regrow disc tissue instead of removing that spine disc and fusing it with a rod, plate, or a screw. And that allows a person to get back to playing golf sooner. And so we expect our patients to go back to activity soon. The Discseel procedure is done as an outpatient. In one setting, the diagnosis is made with the annulogram because the MRI cannot identify all disc tears. And then each of those tears is treated with the fibrin that immediately seals the disc and returns those discs back to their natural strength within 50 minutes. That's 50 minutes. And then we want the patients to go back to activities. We want them to start in a stepwise fashion. I call it the 10% guidelines. So they begin at 10% of what their ultimate goal is, and then they slowly increase the activities. I treat so many pro golfers that the medical physician who heads the PGA spent a lot of time with me. And we concluded that all those clinics are gimmicks. You really can't change the swing to make it safe. It is what makes that player who they are, is what makes that player special, whether it's the weekend warrior or the world champion. And so we can't make the swing different or safe. And that's because of the simple laws of physics. The simple laws of physics dictate that twisting, which is involved with swinging a golf club, twisting causes a shear force on a disc. Some books call it a rotation force vector. And that twisting of the disc will tear the annulus fibrosus. Remember, the discs are made up of two parts, that center gel, and then the outer 17 layers called annulus fibrosus. Well, twisting predisposes the disc to tearing. And that happens. That's just life. It's not necessarily golf by itself, but it's life. So imagine this. If a spine disc was taken out of play by being fused with metal, then that means there'd be worse forces on the remaining discs. And so that means that that same golf swing would actually worsen the forces on the adjacent discs, predisposing those discs to breaking down. The domino effect. That's why so many pro golfers who go the wrong direction of spine surgery or spine fusions end up having multiple surgeries. We all know professional golfers who've had one fusion and then 2, 3, 4, 5 fusions and then even need 6 and 7 more. That's the domino effect. And the Discseel procedure prevents the domino effect. The Discseel procedure seals those discs and facilitates the healing of normal disc tissue. There's nothing else that does that. Stem cells don't do that. Stem cells can't even stay in a disc because it's a leaky disc. We've now got several dozen studies published that show that radio-labeled stem cells that had tracers put on them that were injected into discs, didn't remain there. Within 24 hours, less than 15% of the radio-labeled stem cells remained in the disc. That's why I went the direction of the fibrin. Fibrin made sense because fibrin's a bioadhesive. So when it goes into the disc, it becomes a part of those 17 layers. It interdigitates. We can't get it to leave. We don't want to. We want it to stay there, but it stays there. But more importantly than sealing the disc, in my opinion, is that over time, that fibrin facilitates the growth of new disc tissue. Nothing else does that. And so that means that that fibrin leaves slowly. It's replaced molecule for molecule. The fibrin goes away. Its little monomer branch breaks off the polymer and it's replaced with normal disc tissue, collagen type 1, collagen type 2. And that's been demonstrated in randomized placebo-controlled trials. A great study done at the University of California won the NASA Outstanding Study of the Year. Nothing else in regenerative medicine has ever come close. Nothing else in spine surgery has ever come close. Nothing else in spine surgery even approaches the benefits of the Discseel procedure for treating professional golfers, amateur golfers, professional athletes. And so if a person's looking for permanent solutions so that they can avoid going under the knife a second or third time, then their very best hope is the Discseel procedure. And again, there's no intellectually honest and knowledgeable spine surgeon who would disagree with those facts. And so it's reasonable to look at the Discseel procedure. Even if those spines have already been ruined by fusions or discectomies, those are patients that we treat successfully with the Discseel procedure.